Okay, guys, we go and start soon. Just waiting for everyone, and then we'll start right away. Thank you very much, guys. Please, guys, I think I have started also. We are on Zoom and on Facebook. I already, guys, have started Facebook too. So if you already want to communicate with me, so please, guys, be on the Facebook then. Thank you very much, guys. I know now most of you now being between Zoom, half of you on Zoom and half on Facebook. So if you are on Facebook, please, guys, let me know. Thanks very much. You know what, guys? I was actually talking to myself for more than maybe 5, 10 minutes right now. Guys, am I audible right now to everyone? You know what, guys? I was actually talking. Guys, am I audible right now, guys, to everyone? Guys, am I audible to everyone? I'm not quite sure, guys, if I'm audible or not. Am I Facebook? Yep. Now I can see. Okay, I can see you right now. Hi, Dr. Nema, how you going? Dr. Nema, hello, Dr. Bido. I would like to enroll in your course. I was searched a lot. Okay, please, Dr. Nema. Guys, I don't know, guys. Okay. Please, guys, if you. Okay. Please, admin, if possible, if you can. Please, admin, please, possible, if you can just reply Dr. Nema, please, would be great then. Hi, Dr. Catherine, how you going? Dr. Karishma, how you going? Now I can see you guys. Dr. Fatima, Dr. Hussein, how you going, Dr. Hussein? By the way, Dr. Hussein, I will be in Melbourne, I think the next week, or because we have the course running in Melbourne next week. I stay in Sydney for this week and the next, I think this week and then the week after. I will be in Melbourne, so I will be meeting you then in Melbourne, Dr. Hussein. Hi, Dr. Fatima, how you going? Dr. Samandra, how you going? Dr. Kalvenda, Dr. Gilan, Dr. Niveen, Dr. Nishilani, Dr. Catherine. That's great. Thanks very much, Dr. Hussein saying this. Dr. Merwas, Dr. Fatima, Dr. Aksha. Hi, Dr. Larry, how you going? Dr. Karishma, Dr. Pornami, Dr. Fatima. That's okay then, Dr. Nema. Hi, Dr. Naveen, how you going? Yes, okay, that's okay. Deal then, Dr. Hussein. Hi, Dr. Kelvender, how you going? Dr. Saridani. Yes, please. Okay, that is great then. Okay, guys, so today's session, it's more toward OSCE. And OSCE, guys, it depends mainly, it's an exam, like one part of ADC part two exam. I believe everyone now aware about this. Um, Today it's more like an orientation session, and in same time we're going to discuss about OSCE, the main concepts, my own, I would say, my own experience about why the candidates they can pass OSCE and why other candidates they actually can struggle with OSCE. By the way, guys, if you want really, I think we have some issues in Zoom because I don't know why we cannot, guys, admit all the candidates in Zoom right now. So please, guys, if you have some issues in Zoom, please ensure you are in the Facebook. And then if you are in the Facebook, definitely you have the advantage to comment there on the Facebook and communicate with us. Now, OSCE somehow, the first time ever, guys, we got OSCE for ADC exam that was in 2018. Almost, I would say, either in June or July, around that time. And then everyone really was very scared. If you really want to know the right time, you can check this in my OSCE Facebook group. Anyway, at that time, everyone really was scared about OSCE. And then not many people actually knew what is the importance about OSCE, how you can pass OSCE. It was really a big issue to many candidates, even with ADC handbook criteria wasn't really clear. I would say a few months later, we understand OSCE in the best way. And then we found all the candidates pass the exam and everything's very fine and very good, and then there is no trouble. Lately, we lucky in the academy. We have the last year was the best year ever in our part two as pass rates. In some patches, we got 9 candidates passed, 10 candidates passed, 9 or maybe it's 8 candidates. Every time we've been really very proud about this result, and definitely we're waiting for every one of you guys pass the exam. On the other hand, we found many people that struggle a lot. And the people that really they struggle a lot, the people that don't want to really practice on the right way. Sorry, guys, saying this, but this is the truth. Sometimes I'm actually very, I would say, very open and very clear about the points. But this is one of the things. I'm the one doing role play by myself. I'm trying really to help the candidates to understand about EDC concept on the right ways. And then even as tutors, even with the tutors works in the academy, when they've been one day they've been, I would say, students like candidates like you. And then when we speak about you guys, and then we say why the people cannot pass OSCE, we all get in the same point. They don't listen properly. Sorry guys, but that's true. OSCE is not really something hard at all. We have found people, they have part one, just only part one concepts, and they still can pass OSCE. Just only with part one concepts. Imagine this. But why this? Because they listen properly and then they follow actually what we talk about now. Let me just go through. By the way, today we're going to go through these PowerPoints, not all of them actually, not all of these PowerPoints, because after this we're going to jump to another case, which is clinical case. And then in this clinical case, we go in to discuss it together to give you some hints how to pass OSCE anyway. By the way, guys, as you know, our course for everyone has enrolled to the course for OSCE and for OSCE mainly. The OSCE course will be starting this Sunday, like a week from today. Okay? This, guys, what we're going to discuss. We're going to discuss this case, which is a case for denture stomatitis and angular colitis today. This one. Okay? So somehow we're going to go side to side from better understand about OSCE as a concept and then clinical base as well case. Back again, I'm not going, guys, to give a brief about ourselves, but we are Westmead Dental Academy in Sydney, the Australian Dental Academy in Melbourne, the only academy had actually, I think maybe, I'm not sure, but we are the first people ever helped ADC candidates to pass the exam with 2 academies, one in Sydney, one in Melbourne. And we are the only people actually started from day one to teach part one and part two together. 15 years ago, it was only me teach both part one and two together, and then that's actually I'm very proud of this. Now, Oski, you need to do a very good preparation for Oski. How to do good preparation for Oski? One, you must listen to the lecture properly, attend the lectures, and then listen to the lecture properly. Write down your own notes, very clear notes, what we talk about. By the way, in the lecture, the notes not only the information provided for dental knowledge. It's not. It's mostly toward the communication skills. How to say the right things on the right time was a proper way. And when you prepare, I would always recommend you guys to have more than one study partner. Why? Oscar is like competition. Imagine if you are a sport team and then let's say for rugby, okay? You are a sport team and you play rugby. If you only team that's you only compete with one local team as well, you never be professional. The same things with Oski, same things when you have multiple people to talk about your preparation. That's why I always recommend to have at least 5 or 6 people. You talk together. You actually do role plays together. This is going to be the best preparation based on what we discuss in the lecture, not based on anything else. Because if you're going only to be based on what you know for information, good luck then. Manage your stress. Definitely, guys, management the stress is very important for both, for OSCE or any other ADC exam. Read task properly. We learned this from part one. From part one, we always ask you to read the task carefully. Why? Because when you go to exam, if you miss one line, this line, it could be the key word for the whole case. And this has happened to me. Some candidates, they actually win, they got these cases, and then I discuss with them cases and stuff. You will find that they say completely, I would say, incomplete knowledge. And then when I talk to them, are you sure? They may say, not sure. So why I'm saying this is, if you don't read the task carefully, you're really going to be in trouble. Time management is very important. And then discussion, guys. What we do from discussion? Now, this is a Stranded Academy, guys. I'm not quite sure if you can hear or not.
About 3 years ago now, so 2015. Honestly, I was actually really frightened because it's so different. I'm not quite sure if you can hear or not. My name is Yasmin Taha, and I'm from Lebanon. The main reason we moved here was to have a better future for our children. So many differences. To say this one's quite a funny one, but when I came here, one of the biggest things I noticed was how big the buildings were. At first, adapting in Australia was a little difficult, but now it's really lovely. There's a very big difference. I have to say that it was a lot easier for me as a woman to find a job here. There is a lot more. Definitely more fast. You were? I always feel like once you get used to Australia, you want to stay here. The people at the during that tour time was so supportive. It was really lovely to work with them and to learn from how to go through this period. That has been partner place to keep in connection with the straight people, council, and I'm forever grateful.
Okay, guys, I believe you can hear me right now. Let me just check on this. Yes. Okay, guys, I believe you can hear me right now. Okay. Okay, guys, I believe you can hear me right now. Let me just check on this. Okay, guys, this definitely, Doctor. There's some of our candidates in 2018. And by the way, guys, if you go and check in every one of them, I believe they all passed the exam. This is the Academy in Melbourne. If you have seen the Academy guys in Melbourne, and that's me. About 15 years of experience right now with ADC teaching. And there's Dr. Alifia. She is mainly right now in Melbourne, sometimes in Sydney. Okay, guys, in exam, you're going to be divided into two groups. I think now became 14 and 14, not 12 and 12 anymore. Communication now. Let's start with communication. Scaled OSCE, 4 stations. And communication, the one we're talking about today, they are 6 stations in exam. Introduction. OSCE stands for Objective, Structured, Clinical Exam. And by the way, as we learned from part 1, that when you think all the concepts you learned, right, in part 1, based on objective rather than subjective. What is the difference between both? Guys, do you know, guys, what's the difference between objective and subjective? Let me make it easy for you. Now, for example, right now, if I ask you, this man has something else in his hand. He's holding something else rather than the pencil. He's holding something else inside his hand. You may think about anything, right? And then that's called subjective. What does it mean? It does depends on your thoughts, the examiner thoughts. So if examiner think that you are right, for example, let's say, if you do a margin, if you do a crown prep, and then telling you, for example, the margin for the crown should be 1 millimeter wide. Anywhere, like I'm just saying anything. That means, is it guys mean objective or subjective? If I say the margin of the crown, your crown prep, should be about 1 millimeter wide. So is that objective or subjective? What if I change 1 millimeter to be appropriate width? The margin, it should have appropriate width. Is that now subjective or objective? The first one is objective. Why? Because it's very determined. I mentioned the word 1. It's 1 millimeter. 9 means 0.9 millimeter is wrong. 1.1 is wrong because I said 1. But appropriate width, appropriate, some of you say, oh, appropriate should be 1.2. Someone say, no, the appropriate should be 1.5. That's now called subjective. It's not clear. So part 1, as we learned about part 1, all the concepts we learn, it shouldn't have any assumption in it. That's called no assumption. So now objectives mean, make it easy for you. The word objectives means no assumption. It should be clear information and the clear criteria. Okay, structured means you must be structured the way you talk. Clinical exam. So it's structured based on the objective manner and will be clinical. So mostly talk about clinical. I hope, guys, this is clear to you. What does it mean? It developed in 1975. However, it was really very popular in Australia from 2010 2011. We have seen this system or exam system in Australia. I would say early 2010 2011. But ADC used it in 2018. Guys, you can see this in ADC exam handbook. This taken from there. And then it's been mentioned that you're ready for communication. You're going to have 3 clusters: clinical information gathering, and diagnosis and management planning, and the clinical treatment and evaluation. And by the way, we're going to discuss in every cluster individually of this. So it's 2 rooms, 2 rooms, 2 rooms, means in exam you're going to get 6 rooms altogether for communications. What are the different Osce stations? What this about? Yep. Now, introduction to Osces. I would say you need to learn about 11 color sets. I think now became 12 color sets altogether. About 11 to 12, or actually 12. And then every set is 6 cases. So altogether about 66 cases. There are criteria used by ADC to tell who is the good candidate can pass these OSCEs and the candidate couldn't pass or cannot pass. Communication criteria. So now, let's talk about the clusters. Let's go back here and talk about the clusters themselves. Okay, look, I tell you in part one, we had the same things. 3 clusters. The first cluster is information gathering cluster. The second is diagnosis and management. The third is clinical treatment and evaluations. These are the 3 main things, which is between part 1 and part 2. Now, the candidates actually got very confused between every of these clusters. However, it's very simple things, very simple. When you have a case, and this case mainly about information gathering, let's talk about information gathering. How do you start information gathering case on clinical base? Guys, how you start it? In information, you know what? Maybe greeting the patient. How to greet the patient? There are lots of ways to greet the patient. The best way to be natural, very natural. This happen actually in the clinic. How to greet the patient? You need to introduce yourself first. Introduce yourself, plus you greet the patient. How to greet the patient then? You just say, for example, need to be professional. If it's a morning time, say good morning. Don't say hi. We love the word good morning. Hi, it's not professional. Hello can be fine. Hello, it's okay. Good morning is much better. Like good morning. For example, the first name, if you're gonna call him with the first name, let's say someone, his name is Andrew Lee. By the way, we have a candidate, his name is Andrew Lee, and he passed the exam a few months ago. So if you're going to call him with the first name Andrew, so the proper way is to say, good morning, Andrew. If you're going to call him with the second name, so you should tell him, good morning, Mr. Lee. No, now this is the way. So good morning, Andrew, or good morning, Mr. Lee. I am Adam, the dentist who is looking after you today. Or I am Adam, the dentist, here. That's it. Can I do the same things in every single case? Yes. So now, by the way, guys, in part one, we have similar questions, if you remember. So guys, before you pass part one, I believe you got similar questions, right? So how to talk to the patient, what sort of question you need to ask, is it open-ended question, is it closed-ended question? All the things are really very important. Now, there are something which it's not really very wrong, but I would say in the same time, it is not appropriate. For example, I see some of you say, my name is Dr. This. When I really listen to it, my name is Doctor. It's not your name, it's your title. Anyway, guys, it's communication skills, and I believe the things count as a dentist when you talk. Now, what else involved information gathering? Because we're talking about information gathering. What else? In information gathering, your job mostly is to gather information. Very important question. This question, guys, there are some questions being asked, believe me, since 2018, the first day we got Osce and we told the candidate about Osce until yesterday, until this morning. Doctor, information gathering. Once I was telling the patient that, hi, good morning, Andrew. I am Adam, the dentist looking after you today. Andrew, I see that you are here today because you have pain on the top right hand side molar, the last tooth in the back. Am I right? And then straight away, examiner asked me, Doctor, are you going to take it out? Should I answer or not? And then, doctor, I really got very confused about this. It's information gathering cluster. Can I decide on extraction the first moment in the role play? The answer is very easy and clear. If the case is information gathering cluster, and then the patient asks you about the treatments in the first question. So in this case, yes and no. Yes, it's not only no, because most of the candidates fail these cases, information gathering cluster only, because they only stick to no. No, I will not tell him because I still need to gather information. Once I gather information in this case, I can answer his question. No, it's not. It's not this way. Sometimes, because every case is different, look at the case properly. For example, if the photo has been provided and we found only remaining roots left, just only remaining roots, there is no crown. Definitely the answer, we going to strike to yes. Yes, you're right. I really need to take this tooth out because the tooth is completely damaged only. There is a little bit of stumps inside the gums and the bone need to be taken away. Now, on the other hand, what if the scenario doesn't have enough information to decide? Now, you should tell the patient, nope, you know what, I will be very happy to answer this question, right? Because I looked now at the information I have. I believe I don't have enough information to decide at this stage. But once if I collect a little bit more information from you, maybe I will have better idea. Otherwise, I may need to take an X-ray. However, examiner is very smart and they know the answer already. They know when you should say yes and when you should say no. Anyway, I hope, guys, this point is clear right now. So in the beginning, let's say you say the patient, good morning, Andrew, I'm Adam, and how things go with you? And then he may say, okay, Dr. Adam, you know what, I have this and that, okay. And then say, oh, here, you need to show a little bit of empathy. And by the way, empathy is different than sympathy. Guys, what is the difference between empathy and sympathy, guys? Not everyone know about this, right? I'm sure not everyone knows about it. Okay, guys, empathy, it means you share the feelings or your feelings to the patients professionally to help the patient. So you from inside, right, try to help the patient. For example, empathy can be something like, no necessity to say sorry. I see most of the people say the word sorry to hear that. For example, say that to the patient, or the patient tells you, I couldn't sleep last night, doctor, and say, sorry to hear that. Uh, that's not really proper empathy. But the right way to say something, for example, I'm not saying it's completely wrong. I'm not saying this. You can say sorry, definitely, but we prefer better things. For example, to say, right? To say, for example, I hear you, and definitely, I will help you today to get out from the pain. That's called reassurance, called empathy. So empathy, somehow it has a part of reassurance in it. Guys, am I clear now, guys, between empathy and sympathy? I hope you got it right now. Okay. And then after this, you may need to collect information. Does it really mean to explain every single examination in this life? Not really. And that's why I see people, they fail the exam, and that has happened in part one as well. People really, they choose the wrong answer in part one. Why? Because they just want to collect any information, but we say you need to talk about the relevant information only. The relevant. How is this? For example, if you look at the patient teeth and you'll find there is erosion, which one of these is the most important for erosion? Before you even open the patient mouth, is it visual inspection or X-ray or vitality test or percussion? Which one of these, or actually, I may say all of them important, right? Let's say this. All of them important, right? But which one the most important? Patient with erosion. And the history. Tell you something? History plus visual inspection, they are the most two important information. Let's take another example. Patient with cracked tooth syndrome. Which one is important? One, X-ray. Two, vitality test. Three, crack finder. Four, periodontal pockets depth. Five, transillumination. Are you really go? And then let's say dyes, like stains. Which one of these the most important? Okay, which one of these? The one you're going to talk to the patient about, or the most important? Do you think all of them? No. One, still visual inspection by your eyes. And then that's why I will tell the patient this way. Andrew, you know what? Because actually you have very severe type of pain, which is represent somehow electric shock, as the way explained to me, right? Seems like you really have something we call it as crack tooth syndrome. And here's something really comes. Doctor, can I say jargon in diagnosis? The answer is this. Look at this. Yes. You see how big is yes? Yes, big yes. Yes, you can use the jargons when you explain or you talk about the diagnosis. Now, Andrew, that's why I need to have a good look, right, on the tooth, and then I may need to check the teeth around them. And then this guy is a visual inspection. And then also, you may take for this, you may take photograph. And also, you may need to check with crack finder. And also, you may need to check with dyes if you cannot see the crack. And also, you may remove the restoration, the filling, if necessary, if you cannot see the crack, or sometimes the crack underneath the restoration. But is it really X-ray very important here? Not really. Is it vitality test very important to find the crack? Not really, but maybe important for the management part. But just to know that it's alive or not alive. And dyes can be important. So that's why you may need to talk about this stuff. But what if the crack is really, really visible on the photograph? You don't need to talk about all this stuff at all because already it's clear on the photograph. And you are a dentist, you cannot miss it. Now, let's say you missed it and you start talking about all this stuff. You know what's gonna happen? Examiner said we will mark in the paper. Fail. Easy. How come you can be a dentist and you cannot find the crack on the photograph? I hope guys is clear as well. So now information gathering doesn't mean you must discuss every single investigation that's live. Only one or two that can help you in the situation. Now another big dilemma. Doctor, can I talk about treatment information gathering cases? The answer is yes. Doctor, but it's still information gathering. Believe me, you need to do this. Or you don't need to do it, but most of the time, examiner or the patient has a concern about treatment or about management. They need to know something. I hope guys can hear. Another big dilemma as well. Doctor, can I end up with definitive diagnosis? Can I say the definitive diagnosis or definitive treatment in information gathering class? By the way, guys, I'm telling you what things can make someone, why the people failed, okay? I'm telling you what made the people failed since 2018 until now, and they just keep going around, round, round. I see some of them, right? But definitely not everyone, because I know there are good people, but they may have some issues, maybe with a little bit of communication, maybe the way they used to do it in the beginning, maybe they had some bad habits, but not everyone, honestly. To be honest with you, not everyone couldn't pass, right? This is happening to them, but these are the main reasons. Because I have seen some people they really couldn't pass only because other things. But anyway, now can I discuss? Can I give definitive diagnosis and definitive management or treatment for some information gathering cases? The answer is yes. Yes and yes. How is this? Easy. Let me discuss with you like this. What if you have a photograph of geographic tongue? A tongue like this, and they have a geographic tongue. And this information gathering cluster. What else you want to know? If the patient tells you that his tongue, right, the surface, his tongue surface has white patches, and these patches moving, right, are moving from time to time, from place to place. Easy. It's a geographic tongue. What else do you want to diagnose it? Are you going to take biopsy? No. Are you doing vitality test? No. Are you going to put dye? No. Now, in this case, can I provide definitive diagnosis? Definitely yes. In this case, yes. Why not? Can I provide proper treatment and management in this case? Yes, because the already definitive diagnosis has been given. Okay, let's take another example. What if the patient has swelling, persistent swelling here on the palate, right? That's a palate. And then there's persistent swelling. Can you provide, in this case, definitive diagnosis? Can you provide, in this case, definitive treatment? The answer is no. Now, if you're going to ask me tomorrow, doctor, do you think information gathering cluster all the time I shouldn't give or provide definitive diagnosis? I would say you're wrong. Sorry. If you tell me, doctor, now for information gathering cluster, I should and must give definitive diagnosis and definitive treatment, you're wrong. Sorry. It's not one way. And this is difference between people pass this exam and people stuck. People, they are having open mind. This candidate, they are flexible. They don't follow and mug up only one thing. These people easily pass Osce and ask about this. Okay. I hope all these tricks, there's the main reasons. I would say that's our main reason, make the people fail in information gathering clusters. Once you guys will start the course on this Sunday, even I'm going the capsules because we have our own capsules, right? I'm gonna work on the capsules because I'm gonna finish. I'm going really somehow because I used to add information in the capsules, as you see right now, right? In the capsules. So what I'm thinking in this case, I'm thinking even because I know some of you, I keep telling the candidates, please guys, never mug up anything. Please guys, don't go in one way. Don't just only stick to the capsules and say, I only will read the capsules and pass. There is no way in this life. I tell you something. There are some people they used to teach, and then they used to give the candidate something similar to the capsules, and then tell them, go and read the capsules or go read it, whatever, and they only go on to pass. All these people fail now. All of them fail. And then still because that's a way guys you used to practice in the past. Maybe in our school, I've been one like you. In the school, we used to give us some books and then tell us read these books and then you're gonna pass. It's not. Osce, it's not like this because in exam, they have the right to change the scenario the way they want. They can change the scenario, the same scenario. They can play with a bit of information and you stuck. You may go to the exam two times, the first, and then in the two times, you're going to get the same set of questions or same set of scenarios, and every time find the scenario is different. Again, if you're going only to stick to one way, I'm telling you, you're going to put your risk. I found the candidate they pass Osce. We have most of our champions, they pass Osce. I found them, they are very flexible. When I say something, they actually be able to change themselves quickly and then reply me in the right way and then only just saying one thing. Okay. Anyway, so I'm thinking actually to fix this capsules the way that I'm not going to make it as general. I make it some a little bit more specific into the cases, right? However, the concepts we discuss right now are the most important concepts ever. Capsules, guys, it's something really very easy. It give you all the references in one place. But again, communication not only about reference and data knowledge. What is this? This is a capsule, maybe. Okay, guys, so the capsule is here right now. All information you need at once, but be careful. Information. Communication part, this is what we discuss right now. With reference to data journals, Presidential Journal, American Data Journals, therapeutic guidelines, and Australian dental guidelines as well. Ah, that is great then. Guys, these people guys passed like 3 years ago, 4 years ago, 5 years ago, 6 years ago. And they used to teach as well, guys, now. I think they have teach for sometimes. I'm very proud of everyone who passed the exam and get their own registration, guys. Okay. Definitely, we give you something called the framework. In the framework, right, it has in every cluster, it has the most important points, guys, in every cluster as well. So plus the capsules give you framework, so it's gonna help you. What would I be provided with during the course? Guys, in the course, guys, we gotta provide you with everything you really need. But I'm telling you from now, I swear, believe me, and the gut seek to pass OSCE, it's all about to attend the session, listen to what we discuss, make things simple and easy, very simple and easy. You don't need to complicate the life. You don't need to complicate the things. It's not just only, I must say this to pass the case. It's nothing like this. Nothing. Last time, I have a discussion with two candidates. One of them, they passed the case, and one's not. In the same case, both of them, they mostly say the same things, exactly the same things, right? The same management. But the difference between both actually was the way they say it, the time they say it, how you convince the patient. You look, it's not your job to convince the patient, but you should be convincing. What does it mean? It means you may be a convincing dentist, the best dentist ever, but the patient doesn't want to listen to you. It's not your fault. It's the patient's fault. But on the other hand, you may be a dentist who knows the best information ever. Who knows better than TG? No one. TG is the best, right? Imagine now if you know TG word by word to word, right? And then you're going to talk and you're going to tell the patient about TG. Every single word in TG will be able to pass the exam. The answer is no, because actually the patient should have gone through Google, right? Or maybe the patient should have gone through any of other, I would say, websites, and then they can get more information than you provide. But the way you take the case, the way that to make it easy and simple, the way that to make the patient happy, the way that the patients really trust you. Once the patient trusts you, you're gonna pass OSCE. Don't complicate the life. You don't need to talk a lot. You don't need to talk about everything, but you only need to make the patient happy and they grab the patient attention. And please don't be boring in your role play with the patient. Don't be boring. Okay, guys, we guys use all the stuff like Part 1 G Suite, Google Drive, website, Zoom platform, Telegram. Please, guys, be on Telegram because all the questions will be answered Telegram. Open discussions, one-on-one sessions, personalized replays. Look, that all this stuff we used to do it since a long time. I would say that's easy things to do it. Again, if you are a candidate who's really willing to pass OSCE and Part 2, you will pass OSCE and Part 2. If you really have no time or maybe you don't listen, here is the issue. Guys, we have a black box. It's my recordings. And by the way, I'm actually going to change these recordings somehow because I'm going to follow a completely different technique right now for my recordings and my session. So I'm going to change all of this. I'm going to do new ones, and then somehow I'm not going to discuss about many things because I have noticed the candidates, they stick to what I say exactly, which I don't want this to happen in recordings. I want this to happen during my session. Because in my session, in one case, I discuss it in different versions. That's why when you attend the session, and I keep changing the versions, the way that the way you're gonna get an exam. So in this case, I'm happy when you listen to this information and write down your notes. But in recordings, normally it's just only one version, and then there is no lots of things to actually follow. So anyway, I'm trying now to change the black box to actually get into new techniques. I will use new techniques in it just to make things easy for you. Notes with references for every station. That's true. Online session, guys. We actually have Dr. Raj, and then Dr. Ray, and definitely me, and also Dr. Ann. This is something new happening in this course. Dr. Ann will be helping even in part two. So she's helping in part one, and also she's helping in part two. And how many sessions we have? I think every week we have at least 5 sessions. By the way, guys, I'm telling you something about our course. We actually care about the candidates. We only need the candidate to care about themselves. Our courses, it's for about 3 months a course, 2 month, 3 month course. And even the fees as well. We haven't changed the fees since 2020 or 21. The same fees, about 1700, 1800, and 3 month course. Why this? Because we want you to be there all the time, want to help you to pass the exam. It's not only 2 weeks course or 3 weeks course, because before in the past I used to do 1 week course, 2 weeks course, and actually it didn't help. I found I used even to do it on site, like on site the academy. And then I found really it's not very helpful because the candidates need more time. That's why we discuss one, maybe 3 cases every week or 4 cases every week with different tutors, different approaches, different management, so to get better experience. Imagine, guys, 3 month course. It should be perfect after this. If you really follow in the right way. Now, I have studied, but now I need to check on my performance. Do role plays, please, guys. Ah, by the way, we have Jenny, guys. Jenny, she's a gem. Believe me, I talked to her. She's the one, honestly, teach you if you have any issues communication skills, talk to Jenny. Believe me, guys, Osce easy to pass. You just Osce very easy to pass. You just only need to you only need to follow what we tell you to do. Do replays. I'm very happy to I keep asking the candidates, and then we have booking system for your replays. Okay. By the way, guys, course will start next week, okay? On Sunday. Course, guys, duration, as I mentioned, about 12 weeks, even more, 3 months. And then timing, yeah, our sessions is about 8 o'clock, guys, Sydney time, okay? My session mainly on Sundays. Mock exam, please, guys. Do role plays a mock exam as well. Now, this case, let's see now. Guys, this, guys, if you really want to know more information about this, if you guys want more information about this part, comprehensive course, intense course, crash course, you can please go to guys to our team, guys. So you're gonna get the black box, which is recording for everyone, notes, the capsules, stations, sessions. It's 2 times a week, and this is mainly by me, Dr. No, even now it's more than this. Online support, role plays, and previous, and then black box. Black boxes, perfect, Anoski. Yes, definitely, guys, you can have more role plays. Yes, you can rejoin the sessions again for any reason. We always, guys, and sometimes even sometimes we waive this. If we already discussed with you and they found really you have done well in your exam and really you whatever you, and then our records will see you are really active and you really have done your best. We even waive this fees to rejoin. Apart from questions, let's now discuss this case about denture stomatitis. Now, denture stomatitis. Looking, guys, at this case right now, do you think is an information gathering cluster or clinical, or it's a diagnosis and management planning cluster, or is it clinical treatment and evaluation cluster? Which one of these? Let me check your answer on the Facebook. Dr. Larry said never boring. That is the right one. If you really want to pass this exam, you cannot be boring in the role play. Totally right. What do you think, guys, this about? You know what? Just to make it easy for you. Maybe you are new and then you don't know how to differentiate between both. It is a case of management diagnose and management cluster, guys. How do I know? I have enough information for diagnosis. Look at this. Photograph, angraclitis. Photograph, denture stomatitis. Enough. I already have the diagnosis. Look at the clinical findings. Signs, symptoms. Now it is clinical diagnosis. Sorry, it is diagnosis and management planning. Now, address the patient concern. Explain the condition. Diagnosis. Look, explain. What does it mean? The word condition means diagnosis. So explain diagnosis. Manage patient means management. Management, long term and short term. Address the patient concern. Management. So now, if you want to pass this exam, what will you do? Stick to the three things. That's it. That's it. These are the three things you need to stick to, and that's it. No more, no less. Address the patient concern. Before you start anything, be smart. Tell the patient, Andrew, I took few photos to explain to you more about your condition today. But before I explain this, I would love to hear from you first. Do you have any concern or any doubts or anything to share with me? Smart way to start your case. The patient will look at you like, wow, this dancer is smart. Why? Because you try to make the patient happy. Yes, doctor, I have what? He may give you anything. Doctor, doctor, are you going to give me a new denture today? Oh, Andrew, I got your point. Yes, Andrew, you seem to like really want to get new denture. Look, why not? We can give you new denture, but I believe today it will be a little bit challenging because you have some condition I will explain to you right now. You know, guys, what I did right now? It's called the bridging. What I did now in communication called the bridging. What does it mean? What does it mean, bridging? Bridging mean I took the patient from his point to my point. That's what I want to discuss right now. His complaint was about, or his concern was about a denture. He want a new denture. He wants a new denture. So I made a bridging technique. What does it call the bridging technique? Bridging technique means I started from his point. I used his point, which is a denture, to explain about the condition. So I jumped from here to there based on his concern. What I told him, yes, for example, like, Andrew, Yes, Andrew, I know now what you're concerned about. And you know what? Definitely, Andrew, why not? We definitely can give you new denture if you really like this. But today, I may need to discuss with you my findings, right? And then explain to you if we can give you denture today or not, which I really doubted, Andrew. Why, Andrew? Would you mind right now to look at this photograph and explain to you what you have? Andrew, look at the roof of your mouth here. You said you have pain, or maybe you have some issues in the roof of the mouth and soreness. Right, looking at this photograph, I would say you have inflammation. There's irritation, inflammation, right, has affected the roof of the mouth or your roof of the mouth, and that's why your skin, guys, sometimes we call skin, by the way, they understand the word skin, okay? So your skin, actually, or the roof of the mouth is inflamed and swollen. That's why if we're going to take the impression right now, which is the mold, we needed to make the denture. The first step to make the denture may not be as accurate as supposed to be when there is no the inflammation. That's why we need to treat out this inflammation first, which may take about a week or two. And then after this, we definitely be happy to help you with a new denture if you really like it. Ah, doctor, I have another concern. What is this? Tell me, Andrew, I'm here for you. You know what, daughter? So now my denture is loose. How you can fix this? Ah, that's okay, Andrew. We just go into set some materials inside. We call it as conditioner. It has good cushion effect. So we just bought this. You know, it's easy. It just doesn't take more than 30 minutes to do it for you. Even cheap, not very expensive. It will make the denture. The denture is really very stable and nice to you, Andrew. What do you think about it, Andrew? Ah, that's a good doctor. Okay. That's a guy's a way if you really want to pass your exam. But the other people say it like this way, okay? Andrew, let me now. Okay, this is the way, okay? Andrew, I will explain the diagnosis today. Our diagnosis today is you have a condition. We call it as denture stomatitis. It's a condition means like you have an inflammation has happened because of yeast infection, and this infection can last for about 2 3 weeks. I may need to get swab or maybe not, Andrew. Andrew, you know what, Andrew? What about the hygiene, Andrew? Tell me about the hygiene. How do you brush your denture? Do you really clean it, Andrew? Andrew, to clean this denture, you must do this and this, and don't use dentifrices. The patients are the way like, is the dentist crazy or what? What is talking about? That's too much for me. I don't understand what it's talking about. But this is called what? Your information as TG. So now, guys, if you really wanna tackle these cases the way I explained the first time, that's a way you're going to pass the exam. If you're going to take it the way that's I have pretend right now and act right now, right? So it means you're really gonna struggle with Oscar. However, in both ways, my information were correct. Guys, am I agree, guys, so far? Like, Andrew, do you really take it out? How do you brush, how do you clean your denture, Andrew? Do you really take it out, you put it in dry, or you keep it dry? What do you use? What? Yeah, you can say the same information, but good way. Okay. I hope now, guys, things are clear to you. Anyway, I will be, guys, do you know, guys, Oski, we are always in Oski group. This is group, guys, being the first, was the first ever. This is the first ever Facebook. Let me just get it here. Let me just get all this rid of from the stuff as well. This one down. Back again to Oski. Oski, 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 Oski. Okay, guys, this guy's Osce group, it has everything in it. If you search for every single case, if you search for any information, you will find it here. And from time to time, as you see right now, okay, guys, I see right now, I started actually. Oh, she is very good. That was 2019, Dr. Divya. I even looked younger at that time, right? Anyway, and everything, guys, everything you'll find in this group. And by the way, I used to do some videos as well now for part two. If you have a look in it. So guys, I will be seeing you this Sunday for the first class, and we're gonna go through everything together. Okay, guys? Thank you guys very much. I'm not quite sure if you really have any questions for me or not, but that is okay then, because next on this Sunday, I will be with the first case, the first class with you, and then I will answer you all your questions. The first, guys, everyone is allowed to join the class on this Sunday, 8 p.m. Sydney time. Thank you very much, guys. Have a great night, guys, every one of you. Thank you very much. Bye bye, guys. Bye bye. That's, guys, the Oscar group called ADC Oscar Dr. Adam Bido. Yeah. If you search, guys, in this group, you'll find lots of good information there. Thank you very much, guys. Have a great night, every one of you, guys. Thank you very much. Thank you very much, Doctor. Thank you very much, Dr. Aksha. Thank you, Dr. Lev, very much. Thank you, Dr. Fatima, very much, guys. No problem at all. Have a great night, every one of you, guys. Thank you. Bye bye.